Well, my name is David Simon, and now Dr. David Simon. I'm actually the chief of therapists at an acute care hospital, level 1 trauma center. I'm actually in charge of OTs, PTs, and speech therapists. I've been doing this for 23 years now, and it took me about 10 years to decide to complete my doctorate in physical therapy. I am certified in neuromuscular taping. My clinical background is sort of sketchy. I've done home care, I've done private practice, I've done some sports therapy. I have traveled with 2 Olympic teams in the past when I was much younger and had more energy. Right now I'm just a regular old chief. So my job is primarily 50% administrative, 50% clinical, or I'll go crazy with just administrative stuff. Why did I choose to become a doctor at this late stage in my life? I know most of the therapists coming out are doctors, as we know, and I figured I should at least be on some level be able to communicate with them, as well, the BS degree in physical therapy omitted a lot of the more diagnostic material like imaging and pharmacology and stuff like that. So I think I was lacking in that particular aspect, and this was a great opportunity for me to improve on that particular skill, especially since I like orthopedics.
What benefits have you seen so far just from recent graduation?
We've heard of evidence-based practice, and you have an idea of what it is. It wasn't until I actually took the DPT course and sat with our wonderful teachers that I fully understood the importance of the evidence-based practice and how beneficial it could be for us, especially if you're going to be in private practice or home care or something like that, where you don't have immediate resources like an acute care hospital. I think I've been spoiled over the years, so I really didn't have to think too much about evidence-based practice because it was always there in the hospitals. But if you're on your own in the private setting, I think it becomes more important to be more versed in evidence-based practice and knowing not only how to protect yourself but protect your patients for the most part. In addition, it's not just learning it; it's how to accessing the material and choosing the strongest evidence out there.
David, maybe can you share some of your experience learning from maybe the backgrounds of some other students that were different than what you had done in the past, and how you were able to bring that into your practice?
Oh, sure. Well, my classes were very varied. We had some folks were studying from other countries, as well as most people from the U.S. But even within the U.S., we had many different backgrounds, cultural backgrounds, and that played a big role in one of the last classes we took. But we also had folks who were home care, and even within home care, different branches of home care, different outpatient settings. We had a few who were in hospital settings. I think that there was only one other person who was an administrator, such as myself. But you wouldn't know it, and what I loved about the program was that it addressed the learning from your standpoint, so it wasn't geared towards just pediatrics or just home care, just acute care. It's a topic, and you approach the topic from your standpoint as an acute care or a home care or pediatric therapist. And when we discuss it as a group, we're encouraged to question or challenge or agree with the different points of view. So
okay.
Wherever you come from, I think you'll be fine. And I think that was one of my biggest things. I was nervous as to how I would fit in, since I hadn't been in school for so long. why did I choose Utica? The application process was a lot simpler than some of the other schools was the main one. And I thought it was going to be easy because it was a shorter course. But it is intense. Don't be fooled. You do work. There is a lot of work. Most classes are posted on a Friday, and you weekend to sort of prepare. There is a lot of reading involved, but it's stuff that you'd expect from an online process. It is demanding, but there are so many support systems that are involved, many of which I didn't even have the opportunity to take care of because the ones I chose were helpful enough, and the professors are approachable, so I could drop an email or some professor will give you the cell phone number. You call them, and if you're running into issues or whatnot, they'll work with you. They understand that you have a job as well and you have a family and so forth. So I was pleasantly surprised at the level of support I got from the professors and the level of support that you got online from the school as well. In terms of the residency program, I think that was a good jumpstart. I don't know how many of the schools do it, but for me, for someone who hadn't been in school for several years, the residency program sort of jump-started your school thinking, is what I would call it. It put me in the frame of mind of being back in school and what you have to go through. And the first classes that you do actually take in this course, you do it in residency, and you meet the people that you're going to be interacting with in person. And what I loved also was the grouping. So you're actually put in little clusters while you're in residency, and your very first class is with those people in the cluster. So you become familiar, you get a rhythm, and then of course once you get to the next courses, you may have some of the same people in the class, you may not, but it stays familiar, and it's easier to stay in the program and stay in rhythm once you've completed residency. So I highly recommend, if you can actually go there, do it.
We're going to kind of talk about our admissions requirements. So we are still open for enrollment here for the fall, which starts on August 29th. Kind of talked about the dates for the residency there. The key pieces here are your application transcripts, right? So for our U.S. trained physical therapists, we would need transcripts from your college or university. For our foreign trained PTs, then we would just need a copy of your credential evaluation for that. Your license, a resume, or professional portfolio, personal statement, and letters of recommendation. So we do still have plenty of time to get pieces in if students are still looking to enroll with us. Again, your program manager can go over those in more specific detail, but we can certainly help you through the admissions process and get you forms and such that we need as we move forward.